Advanced Nervous System block for the 7th semester of medical school. The nervous system block in the medical curriculum focuses on the anatomy, physiology, pathophysiology, diagnosis. In treatment of disorders in the human nervous system. Below is a detailed explanation of this block. 1. Anatomy of the nervous system. This block begins with an understanding of the structure and organization of the nervous system. A. Organization of the nervous system. Central nervous system, CNS, brain, frontal lobe. Regulates behavior, executive functions, and motor activities. Parietal lobe. Processes sensory perceptions, such as touch and body position. Temporal lobe. Handles hearing and memory. Occipital lobe. Responsible for visual processing. Other structures. Hippocampus. Memory, amygdala, emotions, thalamus, sensory relay, hypothalamus, hormonal regulation. Spinal cord, divided into cervical, thoracic, lumbar, sacral, and coccygeal segments. Function. Transmits sensory impulses to the brain and motor impulses from the brain to the body. Peripheral nervous system, PNS. Cranial nerves, 12 pairs, for example, the optic nerve for vision and the facial nerve for facial movement. Spinal nerves. Emanate from the spinal cord and manage sensory and motor functions in the body. Autonomic nervous system, sympathetic, fight or flight response. Parasympathetic, rest and digest response. 2. Physiology of the nervous system, a nerve impulse conduction, neuron, function, conduct electrical impulses. Main parts, dendrites, receive signals, cell body, process signals. Axons, transmit signals. Synapse, site of communication between neurons. Types, chemical, involves neurotransmitters such as dopamine, serotonin, and acetylcholine. Electrical, direct signal transmission via gap junctions. Action potential, mechanism enabling nerve impulse conduction through ion charge changes, sodium and potassium, across the neuron membrane. B. Sensory and motor functions. Sensory functions. Sensory pathways transmit information from receptors, skin, eyes, ears, to the brain. Example, spinothalamic tract for pain and temperature sensation. Motor functions. Motor pathways transmit commands from the brain to the muscles. Example, corticospinal tract for voluntary movement. C. Autonomic nervous system functions. Regulates automatic functions such as blood pressure, heart rate, and digestion. 3. Pathophysiology of nervous system disorders. In this block, students learn how structural and functional disruptions in the nervous system lead to clinical symptoms. Examples of pathophysiologies include a common neurological disorders, stroke, ischemic, Blood flow to the brain is obstructed, e.g., thrombosis, embolism. Hemorrhagic, brain blood vessels rupture. Symptoms: hemiparesis, aphasia, loss of coordination. Epilepsy. Abnormal electrical activity in the brain causes seizures. Types: focal seizures, affecting one brain region. Generalized seizures, affecting the entire brain. Multiple sclerosis, MS. Autoimmune disease attacking the myelin sheath of neurons. Symptoms: muscle weakness, vision problems, ataxia. Parkinson's disease. Dopamine deficiency due to degeneration of the substantia nigra in the brain. Symptoms: tremors, muscle stiffness, bradykinesia. B. Nervous system injuries, head trauma. Subdural or epidural hematoma due to trauma. Traumatic brain injury, TBI. Spinal cord injuries, lesions at specific segments causing paralysis, e.g., paraplegia, tetraplegia. 4. Examination and diagnosis of nervous system disorders. This block also trains clinical skills in diagnosing nervous system diseases. A. Neurological examination. Cranial nerve examination. Example: cranial nerve 2, optic, visual testing with Snellen chart. Cranial nerve 7, facial, evaluate facial symmetry and expressions. Reflex examination. Deep tendon reflexes, such as the patellar reflex. Pathological reflexes, such as Babinski sign. Motor function testing. Assess muscle strength using a scale of 0 to 5. Evaluate movement coordination with finger-to-nose tests. Sensory function testing. Examine pain, temperature, and vibration sensations using tools like a tuning fork. B. Diagnostic tools. Imaging. CT scan. Detects strokes or head trauma. MRI. Identifies lesions in the brain or spinal cord. Electrical testing. EEG, electroencephalogram, detects abnormal electrical activity in epilepsy. EMG, electromyography, evaluates muscle and peripheral nerve function. Lumbar puncture, collects cerebrospinal fluid, CSF, to diagnose infections, e.g., meningitis. 5. Management of nervous system diseases. Students learn therapeutic approaches based on specific diseases, a pharmacology, anti-epileptic drugs. Examples: phenytoin, valproic acid. Mechanism: stabilizes electrical activity in neurons. Anti-Parkinsonian drugs. Examples: levodopa, dopamine agonists. Mechanism: restores dopamine balance in the brain. Stroke therapy, ischemic. Thrombolytics like alteplase. Hemorrhagic, blood pressure management. B. Surgical interventions, cranial decompression surgery, for intracranial hematomas. Shunt placement, for hydrocephalus patients. C. Neurological rehabilitation, physical therapy for movement recovery, occupational therapy for independent daily activities.